Hi everyone, it's Zandy. Thanks for coming to my channel. So today's video, I'm going to be talking about my NCLEX-RN experience. So if you want to hear some tips that basically just help me succeed with my NCLEX-RN, go ahead and keep watching this video. I am like so excited that I recently passed my nursing RN boards. I am just still in shock that I'm actually an RN. So I'm just over the moon that I have finally accomplished this goal. I will say that the NCLEX, no matter if it's for RN or PN, is super stressful. Your nerves, your anxiety, it is gonna come into play at some point, but just stay positive and just believe in yourself, because you will do really well if you are strategic about how you actually approach the test. So I'll go ahead and talk about what worked for me. When you are in nursing school, that's basically the best opportunity to prep for your actual NCLEX. So in reality, NCLEX prep truly begins while you're in nursing school. So please understand that while you're in the program, there are things that you are going to see in your readings, in your quizzes, in your exams, that is going to come up again and again, that become trends that should basically become an aha moment that this is probably going to be on my NCLEX. So basically, those are the things that I would take note of when I was actually in the program. Those things help me to really understand what I'm probably going to be tested on at my state board level. So I feel that NCLEX prep truly begins while you're in the program. And another thing that you'll find about a lot of programs, especially for nursing, is that everything is very streamlined and is pretty much the same depending on where you go. Most nursing schools have this very similar curriculum. So I went through an accelerated track program because I was already a practical nurse before I bridged over to become an RN. So even from PN to RN school, I still found there were a lot of similarities. Another thing that basically helped me a lot during nursing school is having a lot of different pocket guides. I am very into quick study reference materials like such. So this one is lab notes. This one is OBGYN notes. I also have one for RN notes. So these were very helpful to me as study materials while I was in the program, because these basically streamline content that is going to help you succeed in nursing school. And also, I use these same books when I was prepping for my NCLEX-RN. So when you're investing in different study materials while you're in the nursing program, try to get things that you feel might actually help you for your NCLEX, so you can be strategic on your investment. I would use quick study reference laminated pocket cards. So this one is pharmacology. And then I will also use quick study references for nursing assessments. So these things I found were super helpful for me when I was in nursing school, and I used all of these things when I was prepping for my NCLEX. And I find them very good, because it was no way I was about to whip out all of those books that you get in nursing school while I was prepping for my NCLEX. So I found that these materials, they're sweet and to the point, and I would use them while I was doing practice questions for the NCLEX. And that takes me into my next tip. You have to do questions for your NCLEX. There's no way around it. You have to do as many practice questions as you possibly can. And when I tell you that is going to help you the most, that truly is going to help you the most, because you have to get into a regimen of just taking questions over and over. So that's basically what I did. I wasn't the type of learner that was reading content again, because as one of my nursing buddies said, you either know it or you don't when you get out of nursing school. So it's no way you're going to relearn everything that they possibly told you in nursing school, because you get so much content thrown at you at such a fast pace. It's nearly impossible for you to remember all of that information anyway. So you have to get into the habit of trying to compartmentalize information and recall information that's going to help you when that question is presented in front of you. So for my question taking, I primarily use the UWORLD app. The UWORLD app was super helpful for me, and I recommend that to others who are getting ready to take their NCLEX-RN. So why did I choose UWORLD for my study go-to? Well, basically, I used it the first time when I took my PN exam, and on my PN exam, I did minimum questions first try. So I'm not trying to reinvent the wheel here, and I'm gonna stick to what I know. So I basically used the UWORLD app again, and I'm super happy that I did because I was successful with the app. Minimum questions, first try, even for my RN. And I relied on that app very heavily. And I like it because it's in your phone. You have the opportunity to do questions on the go, wherever you are. But in reality, the questions in UWORLD can be a little bit challenging at times, and it makes you feel like, what was I doing in school? Because I don't remember any of this stuff. But I think that's kind of the tactic and how the questions are designed, because let me tell you, when I was taking my actual test, I was so thankful for having used the UWORLD, because it basically really got me ready for the NCLEX-RN and really allowed me to go in and get it done, even though my nerves were like all over the place. But UWORLD questions and the way they design the app is super helpful, and it is very similar to the actual real exam to me. So I just found that 3 years ago when I used it, it worked, and even in 2018 December, it worked again. So UWORLD is definitely what I use to pass my NCLEX-RN on the first try. Another thing, as a last pointer, also talking about UWORLD furthermore, is in the app, they have notes and screen capture features. That was so helpful, because let me tell you, sometimes you don't have enough time to really get in a quiet, study conducive environment while you're trying to do practice questions whenever you can. And I found that when I was taking practice exams in the app, that screen capture and notes taking feature was so helpful, because I could basically just scan through different notes for questions that I may have gotten wrong or rationales that I possibly didn't really understand why that was the answer. I would scan the notes even when I could not sit down in a quiet environment and do a 75 question practice test or a 50 question practice test, because when you're really practicing those questions, it can take some time, and that may not be on your side if you're trying to study for your NCLEX while you're working or something like that. So for me, I found the notes feature to be very helpful for me while I was using the UWORLD app. And if you're on the fence about using UWORLD, or you see other videos that talk about UWORLD, I just want to say that for UWORLD, 2 different NCLEX, 3 years apart, I was successful both times, and that was my primary question go-to format for studying on the go. So again, NCLEX prep begins in nursing school. I know you thought it was gonna be some magical thing that I did, but honestly, that truly is it. NCLEX is all about what you learned and how you're gonna apply it in the real world. So your nursing program and your clinicals and your instructors, they're really truly the best study resources that you're gonna get when it comes to being a nurse. And also, they're the best resources that you're gonna get when it comes to being successful on the NCLEX-RN. And also the type of program that you went to. My program was very HESI test driven. So in the comments below, just go ahead and let me know what testing format that your nursing school relied on heavily, because I know they all don't use the same test, but I came from a very HESI driven program. So if you found success on the NCLEX but you didn't take HESI throughout your program, go ahead and comment below so that we can get an idea of different things that people looking to come into nursing or looking to start nursing school or in nursing school right now might find helpful. Thank you so much for coming to this channel and watching this video. I look forward to sharing more information and tips in my journey as a new RN. So go ahead and please like and comment and subscribe on this video. Thanks for watching.